Hi, I'm Dr. Shama here. I'm here with my colleague, Dr. Isabella Bergagnini, from our obesity and endobariatric clinic on 85th Street. I wanted to start by talking about, who are ideal patients that we generally want to see or can see in clinic. And really, from my perspective, the ideal patient is any patient that's been struggling with their weight or weight loss, or maybe who have had a bariatric surgery and initially lost weight and regained it. Because I think we have a more holistic approach here. We obviously see the patients and to discuss about our individual endoscopic sleeve gastroplasty and other interventions, but we do have a multidisciplinary approach, and we do approach it. We do have colleagues in endocrinology and in surgery, so we can really serve as the point person to help these patients on their path for weight loss. What do you think, Dr. Berganini?
So I 100% agree with you on that. So we're looking for patients who are looking for some sort of starting a conversation essentially about their weight loss journey. So to be more specific, we're looking for patients that fall between a BMI of 30 and 40 with or without an obesity related condition. So that can include anything from hypertension, diabetes, fatty liver, sleep apnea. Those patients, as you had mentioned, those who regain weight following their initial bariatric surgery. So anyone who's had a bypass surgery, so perhaps somebody who's had the opening between that gastric pouch and the small intestine has stretched out. So perhaps that needs to be tightened back up. Anyone who's also had a sleeve gastrectomy in the past, if that sleeve has dilated almost to the original size of the original stomach prior to the surgery, we can also tighten that up with an endoscopic procedure. We're also looking at patients who are on anti-obesity medications who have perhaps plateaued in terms of their weight loss progress. And then similarly, for patients who have simply developed an intolerance to weight loss medications. And we've seen a lot of those patients in our clinics. And they may have not even reached their weight loss goal yet, and they are looking for some sort of other less invasive option as opposed to going to surgery. You know, as I mentioned before, we are looking for we rely actually very heavily on our primary care doctors to at least start a conversation with our patients in terms of talking about their weight and then referring to us where we can continue that conversation.
So yeah, I agree. We do rely on our primary care doctors and our family doctors to start that conversation. But if you're a patient and you're listening to this video, you can start that conversation with your primary care doctor. Look for us, get in touch with our clinic as the information comes up at the end of this video, and really kind of start that conversation of how we can get to a healthier eating habits, exercise, but just kind of understanding what needs to be done, what is available, what's out there, and how we can help you hit your target weights and live a healthier lifestyle.